An overactive thyroid, also known as hyperthyroidism, is a condition in which the thyroid gland produces excessive amounts of thyroid hormones, primarily thyroxine T4 and triiodothyronine T3. These hormones regulate many bodily functions, including metabolism, heart rate, and temperature. When the thyroid is overactive, it can lead to a variety of symptoms and health issues. Causes hyperthyroidism can arise from several different conditions, including Graves' disease, an autoimmune disorder where the immune system mistakenly attacks the thyroid gland, causing it to produce too much hormone. This is the most common cause of hyperthyroidism. Toxic nodular goiter or multinodular goiter. The presence of one or more nodules on the thyroid gland that produce excess hormones, independent of the regulatory mechanisms of the body. Thyroiditis. Inflammation of the thyroid gland can lead to the release of excess hormones. This can occur after a viral infection or as a result of autoimmune conditions. Excessive iodine intake. High levels of iodine in the diet or medications can stimulate the thyroid to produce more hormones. Thyroid hormone replacement therapy. Overmedication with synthetic thyroid hormones can lead to hyperthyroidism. Symptoms. The symptoms of hyperthyroidism can vary in intensity and may include increased heart rate tachycardia, the rapid heartbeat, often more than 100 beats per minute. Weight loss. Despite normal or increased appetite, unintended weight loss is common. Nervousness or anxiety. Feelings of anxiety, irritability, or restlessness. Tremors. Fine shaking or trembling, particularly in the hands. Heat intolerance. Increased sensitivity to heat and excessive sweating. Increased appetite, the higher than normal appetite. Menstrual changes, irregularities in menstrual cycles, including lighter or less frequent periods. Fatigue or muscle weakness, weakness in the muscles, particularly in the upper arms and thighs. Sleep disturbances, difficulty sleeping or insomnia. Goiter, enlargement of the thyroid gland, visible as swelling at the base of the neck. Diagnosis. Diagnosing hyperthyroidism typically involves a combination of methods. Medical history and physical examination. Healthcare provider will evaluate symptoms and perform a physical exam, checking for signs of hyperthyroidism, such as a rapid heartbeat or goiter. Blood tests. Thyroid function tests. Blood tests measuring levels of thyroid hormones T4 and T3 and thyroid-stimulating hormone TSH are critical. In hyperthyroidism, T4 and T3 levels are elevated, while TSH levels are low. Thyroid antibody tests. Tests for specific antibodies, such as thyroid-stimulating immunoglobulin TSI, can help confirm Graves' disease. Imaging studies. Radioactive iodine uptake test measures how much iodine the thyroid takes up from the bloodstream. Increased uptake indicates hyperthyroidism. Thyroid scan, a specialized imaging test that can help visualize the size and function of the thyroid. Treatment. Treatment options for hyperthyroidism depend on the underlying cause, severity of symptoms, and individual health considerations. Common treatments include medications, antithyroid drugs, such as methimazole or propylthiouracil, which reduce hormone production. Beta blockers help manage symptoms like rapid heart rate, anxiety, and tremors, but do not treat the underlying condition. Radioactive iodine therapy. A common treatment that involves taking radioactive iodine orally, which selectively destroys overactive thyroid cells, reducing hormone production. Surgery. In cases where medication and radioactive iodine are ineffective, or if there is a large goiter, partial or total thyroidectomy, removal of part or all of the thyroid gland may be necessary. Lifestyle changes. Managing symptoms through dietary changes, stress reduction techniques, and regular exercise can be beneficial. Complications. If left untreated, hyperthyroidism can lead to serious complications, including heart problems, increased risk of atrial fibrillation, which can lead to heart failure or stroke. Thyrotoxic crisis. Thyroid storm, the rare but life-threatening condition characterized by a sudden and severe exacerbation of symptoms, including fever, rapid heart rate, and confusion. Bone loss. Prolonged hyperthyroidism can lead to osteoporosis, increasing the risk of fractures. Prognosis with appropriate treatment. Most individuals with hyperthyroidism can manage their symptoms effectively and lead normal lives. Regular monitoring of thyroid function and symptoms is essential to ensure treatment efficacy and adjust as necessary. Conclusion: hyperthyroidism is a significant endocrine disorder that can affect many aspects of health and well-being. Understanding its causes, symptoms, and treatment options is crucial for effective management. Individuals experiencing symptoms of hyperthyroidism should seek medical evaluation and guidance for appropriate care. Regular follow-ups with healthcare providers can help monitor the condition and prevent potential complications.